apologize for being absent on the vlogs. The end of my pediatrics rotation has been a little bit crazy and kind of tight, and so we've had to kind of push some things back. But I'm actually on my way right now to my shelf exam, and I thought maybe I could record a quick video and we could post the vlog for the end of this week. So stay tuned, we're headed up there now. So in the last vlog that we did, we talked a little bit about finding your passion and kind of all that stuff, and I made mention of the fact that I wanted to do kind of PM&R, sports medicine, family medicine, that kind of a vibe. I think one of the biggest questions that I get all the time, and the topic of this vlog is going to be, what is PM&R and kind of where does it fit into the spectrum of medicine? All right, so we're gonna start like way at the beginning, because I think that's better for some students who may not have that much familiarity with the hospital. When a patient comes to the hospital and they're being seen in the emergency department or something else, they have to be admitted to a service before they can actually go into the hospital. So the problem becomes, who needs to manage that patient? And I guess the question that needs to be asked is, what services does this patient need? For example, somebody who's coming in who has symptoms of a heart attack or something like that needs to be managed on either like a step-down unit or something where they're going to be managed by internal medicine, but they're also going to be followed by cardiology. They're going to have a bunch of those services on. Someone who comes in for a fracture obviously needs to be on orthopedic surgery service, and so general surgery is going to kind of watch maybe some of their care depending on the hospital that you're working at. And so the question becomes, well, what patients is a PM&R doc? What patients do PM&R docs kind of oversee? And really, anyone who's undergoing rehab is under the auspices of a PM&R doc. So that's kind of the first place to start. So I'm sure it would probably be a little bit easier if we used an example. So a patient comes in and they have a stroke. First things first, they need to be medically managed. They need to be medically stabilized. We need to figure out, what do they need to have done? What kind of a stroke was it? Was it an ischemic stroke? Is it a hemorrhagic stroke? How do you have to manage this? Once all is said and done, now that same patient is evaluated and found to have neurological deficits or physical deficits or something that they need treated that would be an appropriate rehab case. So that's the type of patient that would be transitioned over to a PM&R doc's care. So the PM&R doc is going to take over not only their medical care, but also overseeing the entire rehabilitation process. All right, so now that we've established kind of what a PM&R doc does and the patient population that they're going to see, and hopefully you kind of understand where they fit into the hospital, there are thousands of examples of patients that need rehab, that need to have some sort of function restored, and they would all fall under that same category and under that umbrella. But almost got off at the wrong exit. So I'm actually getting close to the area where I have to go and do my shelf exam. So I'm going to get going so I can go and just look over some things and do all that stuff. Okay guys, so just got home from my shelf exam, got a quick shower, got a shave, waiting for Alyssa to get home so we can go and grab some dinner and just kind of unwind a little bit. For a lot of you, you probably haven't or don't know what a shelf exam is. Some of you, if you're medical students, you may have taken step one. But just to give you an idea, take the kind of similar NBME style questions from step one and just condense it down. So don't even ask me how I did. I have a good idea. I think I did okay, but it's just every single shelf exam that you take is one of those tests that you leave there going, why did they ask that? But you have no idea, and I guess you're really not supposed to. But when I was in the car, we last left talking about the different things that a PM&R physician would do for their patients. And then I said that we wanted to talk about some myths in PM&R and kind of some things that students believe about PM&R that I hear a lot. And by no means am I saying that I'm an expert, because I'm not, but I have had some exposure to PM&R in my career as a chiropractor. And Jim and I both, with our experience, feel kind of obliged to share some of these things so that maybe some students who are on the fence or who may have never thought about doing PM&R may choose to look into it a little bit more. So we wanted to talk about these myths, okay? And the first myth that we definitely wanted to talk about and bring up was the fact that if you do PM&R, you're not going to do medicine anymore. Meaning you're going to focus specifically on rehab. You're not even going to, all of your medical skills, all the medicine that you learned during medical school, you're just going to lose all that. That is just completely false. So as we talked about before, the focus of a PM&R physician is to manage the patients medically to optimize them for their rehab. So you're not just going to lose your medicine. You're not going to stop treating medical conditions. You're just going to treat them with a different focus. And that could be more interesting for you. I don't know. So that's one thing. And I hear that all the time from my friends who want to go into internal medicine or something like that. And when I tell them I want to do PM&R, they always ask, well, aren't you going to feel bad that you're going to lose all of your medicine? So that's the first myth that we want to dispel right off the bat. The second one kind of goes hand in hand with that. And that's that because PM&R is so specialized that it's like a very narrow focus. And I learned that was completely wrong at the AAPM&R conference. When I attended, we talked to two different specialists, and when I came home, I actually went onto the AAPM&R website, which for any of you who have more questions about PM&R, log on to aapmnr.org. There's an amazing medical student section in there. They give you a roadmap to, trying to get into residency. They give you breakdowns of all different things. There's an entire section devoted to medical students, and they do a fantastic job. But one of the things that, I didn't know was how expansive the profession itself just has so many different things that you could do under the umbrella of rehab medicine. So we're talking neurorehabilitation, like spinal cord injuries, traumatic brain injuries, stroke, MS, that kind of stuff. There's pain medicine, which a lot of people classically think of. There's musculoskeletal care, so specifically dealing with more musculoskeletal conditions. There are also sports injury pathways. So there are fellowships that can allow you to do sports medicine with a PM&R focus. There's postoperative care, there's pediatrics, and there's then the specialized rehabilitation, which was what I thought was really interesting at the conference. And that's things like fine arts rehab, cancer rehabilitation, which we met a cancer rehabilitation doc who spoke from National Rehab Hospital, and also cardiac rehabilitation, pulmonary. There's so many different ways that you can pursue lots of different things. So, just because you're doing rehabilitation doesn't mean that you're only doing rehab. You can be very specific. You could be very general, and that's kind of a really cool thing about the specialty is that it is so wide, and it does kind of allow you to be a little bit flexible with the things that you want to do. So those are the two biggest myths that we really wanted to try to dispel. One, you're not going to lose your medicine. You're going to use that every day. You're going to medically optimize your rehab patients and get them to rehab better. And then number two is that the specialty itself is really expansive, and it encompasses a lot of different areas of medicine and will allow you to do a lot of different things. So don't let those things detour you. Check it out for yourself. Log on to www.aapmnr.org. Read their medical student section. Continue to watch the vlogs on here. Talk to us. Message us on here. Like our videos. Talk to us about it. And we'll be sure to try to answer any questions that you have and help you to make a more informed decision. Because PM&R is a great specialty, and we're trying to educate you guys about it so that maybe some of you will come over and give it a consideration or try to pursue it like Jim and I are. So give like us on Facebook, all the same stuff that I tell you at the end of every video. We got to try to spread out on social media as much as we can. You guys know that. And so we thank you for tuning in. We thank you for always doing that stuff. And stay tuned. We got some interesting vlogs coming up as I'm starting my family medicine rotation, and we'll have some interesting stuff in the next coming up weeks. So we will talk to you guys soon, and take care. But for now, I'm gonna go eat some dinner and try to unwind a little bit. Try to let my brain decompress. So wish me luck. I'll talk to you guys soon.